A 75-year-old woman comes to the physician because of left-sided knee pain. She has come to his office several times for minor problems over the past 6 months. She has been a patient of this physician for over 20 years. She reports that over the past 6 months, she has been drinking 4 to 5 glasses of wine per week. Before she only drank occasionally. Physical examination shows no abnormalities. After the examination, the physician asks the patient if anything else is bothering her given her frequent visits. She says, "Every time I see you, I think of my late husband. I miss him very much and have been feeling so lonely, but being in your company makes me feel better." Which of the following is the most appropriate response by the physician? All right, we'll go over all of the options, but remember what she says. Okay, you basically you ask her if anything is bothering her, and this is what she says. A patient comes to her and they say that, yeah, I mean, nothing is bothering me, but every time I see you, doctor, I think of my late husband. I miss him very much and have been feeling so lonely, but being in your company makes me feel better. So you're sitting in front of a patient and a patient has told you this. Now you look at A to F and think about what you will say when a patient tells you this. "I'm sorry for your loss. Would you like to tell me a little bit more about your husband?" Very likely option. Option A is very likely. We'll keep it in mind. Let's go over the others. "It is common to develop depression after the loss of a partner. Would you like me to refer you for counseling?" Think about it. You've known a patient for 20 years. I mean, some people are not married also for 20 years. But you've known this patient for 20 years. And this is your response that you come up with. After she tells you her husband has died few months back and she's feeling lonely, and you say, "Yeah, it's common to develop depression after the loss of your partner. But I'm just going to refer you now for counseling to a counselor or a psychiatrist or something like that." Sounds very unempathetic and like you don't give a shit about your patient. So option B, even though it sounds, I mean, when I've put it in this perspective, it sounds horrible. When you're just reading a question and you have 90 seconds to answer, you don't think much about it. But that's the key to behavioral science questions. Put yourself in the patient's shoes and basically think of you being a patient of a doctor. Would you like to hear that from your doctor who you've known for 20 long years? Option C, do you have family in the area who can help you with your grief? It would be inappropriate for me to take on this role. I mean, yeah, it is inappropriate. Yes, family would be the ideal people to take care of a grief, but would you want to respond to a patient like this? You wouldn't want to respond when you have a better way of responding to a patient. I'm just saying that maybe option C would have been better if option A was not there. All right, but you have option A, so why choose option C? So that's why in behavioral science you have to look at all of the options because there might be one that's better than the other. And yes, it is inappropriate for the doctor to take on the role of someone who of support of the take on the role of of an individual who support the patient during grief and things like that. Maybe, may not be, you can never say, but it's definitely not the best option when you have A up over there. I understand you are still grieving. I would like to prescribe you a medication to help with your knee pains. This is very funny, and just think about it. Just have a patient ask you, "Every time I say anything of my late husband, I miss him very much and feel so lonely." So someone, you tell a doctor that you've just lost someone significant in your life, and he's like, "Yeah, you're still grieving, but forget about that. I want to talk about your knee pain." That doesn't make any sense at all. So forget D. That's very unempathetic. Option E, that must be very difficult for you. However, I hope you understand that you should limit your visits here to urgent medical problems. Yes, option E is partially correct. I'm not saying that it's completely incorrect. It's similar to option C. Option C and option E are both like partially correct, partially incorrect. Yes, you're empathizing because you're saying that must be very difficult for you. But then after that, you're saying, however, I hope you understand that you should limit your visits here to urgent. Here, you're basically telling the patient that she should only come when she has urgent medical problems. And don't forget that this is a 75-year-old, she's an old lady. Okay. Um, I think that she's lost the husband some time back. She's probably living alone because that's how people in the US, old people in the US live. They live alone. And this lady could easily go into depression, definitely, and then you can have suicide and things like that. So this is probably not the best thing that you should say. You should not be limiting her to how many visits she has. And basically this is something that you want to explore further. You want to explore her grief. You want to know, it's been 6 months now that she's been having this problem, and she's been drinking, and you want to be able to identify whether this is complicated grief, whether it's uncomplicated grief. Basically, by telling the patient not to visit you, you're just washing your hands off the patient's medical problems. It's not ideal. Last option, it is common to drink more alcohol than usual after the loss of a partner. Have you felt have you ever felt you need to cut down on your drinking? Yes, she is drinking more than normal. Yes, she would probably be using alcohol inappropriately and probably be suffering now from probably early stage of alcohol dependence. But you're not addressing her question. You have to put yourself in, I've told you, put yourself in the patient's shoes. The patient says that statement. I'm not going to read it again, but she says that to you, and you're like, yeah, it doesn't make sense. Like the reply doesn't make any sense to what she's told you just now. She's told you that she thinks of her late husband, and you're like, it's common to drink more alcohol. That's not a conversation. And that's what you have to also remember. I'll just go over something random. This is something you remember during interviewing season also. Like people have these prepared answers that they have for for questions that program directors ask them. But remember, it's a conversation. You're having a conversation. There is no scripted answer over here. So when you have a question, logically, how would you reply to a question? When you logically reply to the question, keep in mind all of the principles of medical ethics, about being empathetic, about some of the rules in the state, things like that. And you answer the question appropriately. So that's why option A is the best. I'm sorry for your loss. Would you like to tell me more about your husband? Yeah, when a patient tells you that they remind you of their late husband, you're like, oh, okay. How was your husband? What was he like? Why do I remind you of your husband? That's how it should go, right?
Thanks for watching. Please give a thumbs up and subscribe for more.